In this video, we will describe how to perform liver biopsies in cattle, and it will be presented by myself, Dr. Pippa Gibbons, and my colleague, Dr. Clinton Roof.
Liver biopsy in cattle can be an incredibly useful tool. It's direct and definitive and can give us information about liver function when blood work, history, and response to therapies are not working. It is a very high yield and practical test to perform, especially on a dairy cow, and can tell us a lot about hepatic lipidosis. Those can argue that NEFAs and BHBAs can tell us about lipids in the system, but they only tell us about risk, not severity. A biopsy can help with severity and make a decision on whether culling or treatment should be performed. It can also be very useful in letting us know if we have mineral accumulation that shouldn't be as high as they are, or mineral deficiencies that need to be supplemented in the diet to help with physiology. It can also aid us in damage to the liver based on toxicities, whether plant or heavy metal or other, and give us a better picture for the treatment and outcome of that animal.
So this is the kit we'll need for liver biopsy. You can do this in a sterile technique, or if you're doing multiple animals, you might want to cold pack between them. So we have clippers, we have aseptic prep, sterile gloves. For our sample tube, if we're doing mineral analysis, we do not want to use a rubber cap, so we want to use plastic or a dark blue top tube. If we're doing histopathology, we'll want to add formalin to the tube. We'll need a needle to remove the sample from the biopsy tool, and we are going to use a manual biopsy tool, true cut biopsy tool today, and we have a 15 blade to incise through the skin, and lidocaine to anesthetize the skin and intercostal muscles. For sample size, this is a 16 gauge. You can use a 14 gauge. Sample size for mineral analysis does depend on the lab. In general, you want at least 2 to 3 samples, depending on the size. So when we're localizing where to do the biopsy, there are 2 estimates of where the liver is located on the right-hand side of the cow. And this depends on whether the animal is pregnant, how full her rumen is, and the age of the animal. So one is on the line from the tubercocci to the elbow at the 10th intercostal space, and the other would be mid-paralumbar fossa. So we're going to confirm this with ultrasound. So in this cow, we're starting at the mid-paralumbar fossa, and we can see lung coming in here, so we're going to go more ventral, and this is the region we want to biopsy. So we can see if I freeze this image, we're going to be at about maximum 10 centimeters, as much as we're going to take our biopsy. And we have about 2 centimeters of skin and intercostal muscle. So we're going to prep the location we have identified. Then we're going to perform a local block through the skin and into the muscle. So this is a manual true cut tool. If I push the cutting edge out, you can see that this is the sample where the sample will fill. So what we're going to do is we're going to choke up onto the tool approximately halfway, especially for this cow. And we're going to insert it through the skin incision, and we'll feel a crunch as we go into the liver. Once we're in, I will deploy the back to open up the cutting, and then I will keep the back still and push the tool over to slice the liver and to obtain a sample. We'll then pull out and push it forward to take the sample off. Now we've identified the liver location and confirmed it with ultrasound. We have clipped, prepped, and blocked with lidocaine. Now I'm going to make a stab incision through the skin with a 15 blade. Now we're going to make sure our tool is closed, and I'm going to insert the tool through the skin incision, the muscles, and into the liver. The vasculature and nerves run on the caudal side of the rib, so we're going to go towards the caudal side of the intercostal space to avoid those. And we know from the ultrasound in this cow that it should be about 8 centimeters. So we're going to open the biopsy tool, and we're going to lift off our sample using a needle into our sample container. This is a small sample, so we need to collect multiple biopsies.